I'm Dr. Claudio Levato, and we are at the ADA meeting in San Francisco. We're sitting here talking to Dr. David Ahearn of Design Ergonomics, and we're going to discuss the importance of ergonomic delivery of dental care and where everything is positioned. David, what can you tell us about the differences between your concepts and most of the other concepts out there today?
The essence of what we've done is to focus on the manufacturing aspects of delivering dental care. Typically, the room that dental care is delivered in acts as both a delivery center and as a warehouse. When we began to focus on this, we studied the Toyota production system, and it led us to a more consolidated system of delivery which focused on the patient head. Now, this can accommodate handpiece placements, multiple handpiece placements. That's not the essence. The essence is making sure that all the supplies are centrally located directly in patient range without having them be in patient view. So the first thing that we did was to go ahead and make sure that we had an accommodation for full supplies. All your consumables are here, but can also be hot swapped during treatment, so that this is approximately a week's supply of your consumable supplies. Your sharps and med waste are then accommodated here. By doing that, and then by shaping this top so that you could go ahead and bring this closer to the patient, we're then able to bring the assistant within full reach of 3 tiers of product, and that's the basis of the patent. We integrated computer technology over a decade ago, knowing that that was going to be a central part of what we did as dentists, was to enter into a digital record. And we needed to make that possible to come out of the way after use. All of your supplies are then consolidated in tubs, which can again be hot swapped during treatment. But 90% of our daily consumable supplies are in this tub. They can be staged here. Guns can be hot swapped for direct impression. The important essence of this is that this can work in 4-hand use. It can also work in 2-hand function when you rotate this when the doctor leaves the room and the assistant may be finishing a procedure. All of these holders being milled directly into the solid surface allow us to have the ability to configure this however we see fit. And for left-right convertibility, you simply slide this to the other side, and this entire delivery channel then rotates for left-hand use. So that can be done in under a minute. In addition, we felt that with the increasing technology for the integration of electrics, we were concerned with the ability to service these rapidly. So we developed a delivery system that can be hot swapped in 20 minutes. So if for any reason there's a service issue here, this entire unit can be swapped in 20 minutes.
Okay.
And no one else in the industry can do that.
And tell me what features you're able to bring to that unit.
This has full integration of digital handpieces. It has all suction utilities supported directly in the unit. It allows accommodation for ultrasonic scalers, camera integration. This shows light curing units fully integrated into this. It's got USB connection ports on the backside, 120 power on the backside for any other supplies. So we've got full digital integration. We've got full integration of electronic handpieces. We've got ultrasonic integration, all in one head that's under 8 inches wide. And because of the narrowness of this, it allows us to bring this forward. A traditional unit being over a foot wide winds up behind the patient. This has been referred to as over-the-head delivery because the doctor is able to go ahead and bring this directly over the head, or this can be staged here for the assistant to pass the handpiece to the doctor. So you cut down the motions, you cut down the cost of inventory, you cut down the speed required. Now, another important factor besides the 4-hand use and the 2-hand convertibility is the ability to convert for specialty procedures. Because in a typical operatory, when a doctor is preparing, you know the situation where you're doing a crown, the patient was supposed to come in 2 years ago, they didn't make it in. Now, as you're preparing that tooth, you've got it's an endodontic tooth. You got a big hole in the middle of the tooth, and now we've got to go endo. Most offices, the problem is that to go ahead and convert that room to endodontic procedures, if they're in a multi-operatory setup, it may take 4 or 5 minutes to convert or more. in this situation, we're able to go ahead and call in and convert the room with one plug, and we can have all of the functions on this cart, which could be 4 or 5 power functions, all go live with one connection.
Okay.
Suddenly, by making that connection, we're able to go ahead and convert this to an endo procedure in our office in under 40 seconds. Any room at any time. And that's whether that's a laser, whether that's a CEREC, whatever high technology, we have room because we've consolidated the primary setup. We're able to bring the high technology here.
Your whole premise, though, is predicated on the use of a mobile.
This can be arm mounted or cart mounted.
Okay, but mobility is the key factor involved.
Mobility is important because the machining center in a factory, you move the part around the work center.
Okay.
In cellular design, any manufacturer these days, that has high productivity is moving the part around the factory. You can't do that in a dental environment, so you've got to move the technology around the machining center, which is the patient's head.
Okay.
This is the essence, and too often we spread the technology out so far that much of the time is spent reaching for supplies that are here or are outside of the room, and as a result don't get utilized on a day-to-day basis. Things like lasers have low utilization rates in offices because many times doctors just don't want to take the time to bring them to bear in the room that they're in.
What about monitor placement?
Monitor placement is here.
Isn't that a little high?
It's a great question. The Microsoft lawsuit, which caused which they paid for the ergonomic standard, which shows a keyboard at a certain height range and the monitor right here. That's the standard. It assumes you're using a monitor and keyboard all day.
Okay.
For the primary use here, now this is the data monitor. This is schedule monitor, where we don't want the patient. The flexibility to look here for that short-term use it has no ergonomic ramification. What happens in the setups of today is with the monitor placement here, you're displacing this, which you use all the time, to there or to here.
Okay.
So it's really a question in ergonomics. What you look at is primary function, secondary function. A monitor function is a secondary function. For doctors that use digital radiology, what we'll do very commonly is have a monitor here or a monitor here.
Okay.
For doctors that are using digital microscopes, we'll want to have a monitor here. And then a monitor certainly needs to be up above the patient for patient entertainment.
Okay. Well, thank you very much, David, for your time and explaining your concept. And
it's been a pleasure, Claudio.
Have
Thank
a great
you for
day.
coming by. Thank you all.